All right, so today we're going to dive into something super important, breast health. And, we're really lucky to have some great material on breast cancer signs and symptoms.
It really is all about empowering yourself.
And that's so important. And that's what I really love about this ebook, Breast Cancer Signs and Symptoms, by Dr. Diana L. Lamb.
Oh, she's fantastic.
She is. She's doing such amazing work in the breast imaging world.
At the University of Washington and the Fred Hutchinson Cancer Center, I mean.
Exactly. And I really appreciate that her focus is early detection. So let's jump right in because, we all hear about checking for lumps.
Right, and it's a common misconception that that's the only sign of breast cancer.
Oh, really? See, I didn't realize that. And this ebook points out all these other surprising things that could be red flags.
Like changes in skin texture.
Oh, wow, really?
Absolutely.
Like what?
Well, they talk about things like, enlarged pores,
Hmm.
where the skin, it almost looks dimpled. They actually call it orange peel skin.
Orange peel skin.
Yeah.
I never would have thought of that.
It's a classic sign of inflammatory breast cancer, which can be, a pretty aggressive form.
And that's why catching it early is so important.
Absolutely.
Wow, I had no idea. There was a connection there. So it's not just, okay, so we've got skin changes, but they also talk about nipple discharge
Right.
and even dimpling of the skin itself.
Yeah, it's really about those subtle shifts.
Mm.
Your breasts shouldn't look or feel drastically different from one day to the next. So
Right.
any noticeable change is worth paying attention to.
Okay. So that's where I guess breast self-exams come in.
Exactly.
And Dr. Lamb really breaks down how to do them thoroughly.
It's not just a quick feel in the shower.
Yeah.
Although that's a good start. She talks about examining your breasts in the shower, in front of the mirror, even lying down.
All those different positions.
Yeah.
Interesting. And speaking of, doing it right,
Yeah.
they actually go into detail about how much pressure to use, like light, medium, firm.
There's real technique to it.
Wow.
It's about knowing what's normal for you and then being able to identify any changes.
I never thought about like the
Yeah.
pressure and stuff. I just thought it was like, are there lumps or not?
Yeah, you really have to get in there.
So it's not just about finding lumps. Is there more to it?
Yeah, it really is about really understanding your own body and knowing when something feels different.
Mm-hmm.
And that's really a big part of Dr. Lamb's message throughout the book.
Okay. And she like really gets into like those what if moments,
Totally.
like those things that make you worry. Like, what if I feel something, but maybe it's nothing,
Right, like that whole, is this a lump or is this just my normal?
Exactly.
Yeah, she really tackles that head on.
Which I think is so important.
Yeah.
Because, I think that's what we all worry about.
And she talks about, the difference between something that's potentially concerning versus something that's probably benign.
Okay. Like what kinds of things?
Well, she talks about if it's hard, if it's fixed, and if it's growing.
Hmm.
Those are more worrisome than one that's maybe a little softer and more movable.
So it's not just about whether it's there or not. It's about how it feels.
Exactly. And another thing that she clears up a lot of anxiety around is breast pain.
Oh, yeah. Because, don't a lot of women experience that?
So many, especially around their periods.
Yeah.
But it's very rarely due to cancer.
That is reassuring.
It is.
But of course, like any persistent pain,
Talk to your doctor.
right? Always talk to your doctor.
Always. This is not a replacement for medical advice, but it definitely gives you the knowledge you need to advocate for your own health.
Right. And to ask the right questions.
Exactly.
So you really understand what's going on.
Absolutely.
One thing I always found really confusing were the different types of breast cancer.
Oh, yeah.
Like I hear ductal, lobular.
Yeah.
What does it all mean? But this ebook breaks down ductal and lobular carcinoma in a way that like finally makes sense.
It's helpful to think of the breast like a tree. Like imagine the branches are the milk ducts and the leaves are the milk glands. So
Okay.
ductal carcinoma starts in the branches and lobular starts in the leaves.
Oh, wow. That's a great analogy.
So they're both serious, but it helps you kind of visualize where they originate and how they might progress.
Right.
And, while there are those differences, she also makes it very clear that you can't determine the type based on feeling alone.
Okay.
That's why mammograms and professional evaluation are so important.
And speaking of, often overlooked aspects of this,
Yeah.
what about men?
Yes.
Because it's this misconception that they're immune.
Right, like it's not a problem for them,
Exactly.
which is simply not true.
No.
And Dr. Lamb actually dedicates a whole section to male breast cancer,
Yeah.
talking about, what are the signs that men should be aware of and when should they seek medical attention?
Yeah, because I think a lot of guys probably just wouldn't even think about it, right?
Exactly. And then they might just kind of brush off any changes.
Because they don't even realize that they're at risk.
Right, exactly. And that's why, like we were saying before, this kind of information is so important.
It is.
You know, it helps get rid of those myths
Mm-hmm.
and it encourages everybody to, be proactive.
Take charge of their health.
Exactly.
It's all about knowledge as power, right?
Absolutely.
Knowing what to look for, feeling empowered,
To advocate for yourself.
that can make all the difference.
You really can.
This has been a really eye-opening deep dive, I gotta say.
Yeah, it's amazing how much Dr. Lamb fit into this ebook.
She really covered it all.
She did.
And, she's clearly passionate about making sure people have that knowledge
Yeah.
to really prioritize their breast health.
She wants people to be informed.
I feel like we just scratched the surface.
Yeah, we did.
But hopefully you're walking away feeling a lot more equipped
Absolutely.
to have those conversations with your doctor
Yes, and to understand,
and take charge
what questions to ask.
of your own well-being.
Yes.
And I love this, when we first started talking about it, I thought it was going to be very clinical, very medical.
Right.
But she really put so much emphasis on just that, like, personal awareness.
It's about really connecting with your body,
Yeah.
understanding what's normal for you, so that anything that's different really stands out.
That's really at the heart of it, isn't it?
Yeah. Early detection is key.
It's like she's saying, this is your body, get to know it.
And be its best advocate.
That's great. Well, I don't think I can look at a grapefruit the same way again after reading that section.
I know, right?
But in all seriousness, thanks for joining us for this deep dive on breast health awareness.
It was a good one.
Hopefully you're walking away with some really great insights and feeling empowered
Absolutely.
and, ready to take charge of your health.
Take care of yourselves, everyone.
Thanks for being here. We'll see you next time.